My name is Rachel Cohen. I'm a clinical psychologist and I'm coming from New York. I am the founder and director of Common Threads Project, and I have the honor of being able to lead with my colleague Tally Tripp to lead a training here so that the therapists and mental health professionals in Panzi can learn to implement this project Common Threads with the beneficiaries here at Panzi Foundation. It is a specific intervention that we have developed that is for long-term psychological healing for victims of sexual violence and other kinds of gender-based violence. And I can try to describe for you what is Common Threads. I want to say that we are now in the fourth day of a 10-day training, and the trainees who are staff here at Panzi Hospital and Foundation, as well as some from Kamituga and Luenge, have been busy at work trying to learn many skills that are involved in this quite comprehensive intervention. And it fits very nicely, I think, with the holistic model of Panzi that I so admire. And for me, it's really been a dream to come here and work together with Panzi Foundation, with the Dr. Dennis Mukwege Foundation to support this work, because I think it adds a dimension that's very important, which is the long-term and intricate recovery process for victims of violence, victims of gender-based violence. We say in Common Threads that we try to help the women move from victims to survivors to agents of change. It's a process of empowerment. And although it's a psychological intervention, it follows the same philosophy of the holistic model, that we want to see women becoming more and more self-sufficient, more and more capable. To do that, they need to heal from the wounds that they carry deep within themselves. That's one very important step. Not the whole story, but that is our focus, is healing from the psychological damage that they suffer. We have taken a very ancient practice from cultures around the world, and we've tried to learn from that practice and integrate it into the work that we do therapeutically. That practice is very simple. Women who have suffered atrocities from many different cultures have come together in different settings around the world to support each other, to share their stories so they don't feel alone, and to sew their stories into cloth. Because very often the experiences they've had, they cannot put into words. So this becomes the beginning of a comprehensive therapeutic intervention whereby they can begin without words and very gradually and safely and gently move through a process of healing that also makes use of many of the best techniques from contemporary trauma therapy. So it takes quite a bit of skill, and we're very pleased that the psychosocial staff here has very good background and can bring those skills to bear on this very complicated process. As I told Dr. Mukwege myself, he has inspired me a great deal for a very long time. And meeting him and talking with him only confirms my admiration for him, and the way that he understands far beyond the surgery that he does and the medical work, and how he has developed the holistic model, his understanding of my field of psychology was really very, very moving to me, because he understands that it's through the body that much of trauma gets expressed, that the body is speaking the trauma. The body tells the trauma story. And he understands that words are often not there to tell the story. It happens that trauma is held in the body, trauma is held in images, and we were really very much on the same wavelength about this. And he was talking about how much he would like for the medical profession to understand these principles, to understand, and the mental health profession, I feel, also needs to understand these principles. And we talked about working what we call from the bottom up, meaning from the body to the feelings, finally to the cognitions and to verbal expression, but not starting with cognition and working down. It goes the other way, and it was really very amazing to me and exciting that we see that in the same way. And so it's quite a thrill to not only to meet Dr. Mukwege, but to discover that his insights about trauma are, for me, so exactly on target.